Mr. President, the October 2011 issue of the AARP Bulletin, one that I received in the mail, it contains an interesting opinion piece, and it was written by the Senate Majority Leader, Harry Reid. It's right there, front page, Senate Leader Reid, and his opinion piece is titled, "The Health Care Law is Already Working." Well, I come to the floor, Mr. President, as I do from time to time, to give a doctor's second opinion, and I have a second opinion today about the piece in the AARP paper. I find the title, the choice of the words, "The New Health Care Law Works," I find those ironic, especially as the American people continue to express negative views about President Obama's health care law. So I come to the floor as a physician who's practiced medicine in Wyoming, taking care of Wyoming families for a quarter of a century, to talk about the health care law and to talk about health care in America. What we see, Mr. President, is a growing majority of Americans want to see the entire law repealed and replaced with patient-centered reforms. Now, don't take my word for it. Let's look at the facts. On October 28, 2011, just last week, the Kaiser Family Foundation released its monthly health tracking poll. This is a nonpartisan Kaiser survey, and it tracks the public's views about the health care law, and they've been doing it ongoing. Well, the results this month are truly astonishing. About half of all Americans have an unfavorable view of the health care law. Overall favorability of the health care law stands at just 34%, an all-time low. The number of individuals who view the health care law very favorably stands at 12%, an all-time low. The number of people who think that they will personally be better off due to the health care law stands at 18%, an all-time low. The number of individuals who think that the country as a whole will be better off due to the health care law stands at just 28%, an all-time low. Approval of the law among Democrats dropped 13 percentage points to an all-time low. Mr. President, these results make it clear that the new health care law does not work. 19 months ago, Senator Schumer, my colleague, the senior senator from New York, claimed on NBC's Meet the Press that, quote, as people learn about the bill, and now that the bill is enacted, it is going to become more and more popular, close quote. Well, the president and Washington Democrats miscalculated. They made numerous promises to the American people, and they said we need to act fast. We can answer questions later. They asked the American people to trust them. Then the nation watched as weeks went by, news stories uncovered another health care law glitch, another health care law unintended consequence, and another of the president's broken promises. Seniors all around the country know that the president's health care law took over $500 billion from a broken Medicare program, not to save Medicare, but to start a whole new government spending program for someone else, not for seniors. Medicare patients know that the health care law failed them and failed to address the broken physician payment system. America's seniors understand that Washington Democrats can't cut $500 billion from Medicare and then claim that those cuts won't impact their own health care. When you look at Medicaid, governors all across the country know that the health care law's Medicaid expansion will restrict patient access to care and very likely bankrupt our states. Medicaid only pays health care providers cents on the dollar. That's why about 40% of physicians don't accept Medicaid patients. Having a government health care card doesn't mean patients will actually have access to medical care. We also have concerns, since the law was passed, about employers dropping coverage. President Obama promised that if Americans like their current health care plan, he said that under the law, they would be able to keep it. Well, over the last 19 months, employers have made it clear that the law's mandates are too expensive, threatening their own ability to offer health insurance to their employees. A reputable national consulting firm surveyed more than 1,300 employers across industries, geographies, and employer sizes. The company produced a report titled "How U.S. Healthcare Reform Will Affect Employees' Benefits." The company, McKinsey & Company, found that overall 30% of employers will either definitely or probably stop offering employer-sponsored coverage after 2014. And that's when the President's health care law goes into full effect. Among employers with a high awareness of the health care law, understanding the specific implications of the law, that number of those who will either definitely or probably stop offering employer-sponsored coverage jumps to 50%. At least 30% of employers would actually gain economically by simply dropping coverage, even if they compensate employees through other benefit offerings or higher salaries. So how did we get from, if you like the plan you have, you can keep it, to 30% of employers will either definitely or probably stop offering health insurance? The problems continue to mount. Recently, October 20th of 2011, Walmart announced its decision to scale back health insurance for some part-time employees. A New York Times article explained that future part-time Walmart employees working less than 24 hours per week won't be allowed to join the company's plan. New part-time employees working between 24 and 33 hours a week, well, they won't be able to buy insurance for their spouse. The New York Times article quotes Walmart as just saying that the increasing cost of health care is the reason for the change. Now let's take a look at people's premiums. In 2009, President Obama promised his health care plan would reduce health insurance premiums $2,500 a year for families in America. Well, the opposite has occurred. President Obama's law has forced Americans to pay more for their health care premiums. On September 27, 2011, the Kaiser Family Foundation issued a report showing that the employer average annual family premium increased 9% from $13,770 to $15,073. The employer average annual single premium, the other was the family, now for singles, premium increased 8% from $5,049 to $5,429. And of course, part of this premium increase is tied directly to the health care law. Then let's look at the CLASS program. That program has recently failed. Remember, President Obama's health care law established a brand new federal long-term care entitlement program. It was referred to as CLASS, but the letters stood for Community Living Assistance Services and Supports. Well, to qualify, people would have to pay the government a monthly premium for 5 years. And then after those 5 years, they could begin collecting benefits. Well, it's now known that the CLASS program was an intentionally designed budget gimmick. The Congressional Budget Office estimated that the CLASS program would reduce the deficit by $86 billion. The savings were mythical. And those savings came from the premium dollars that the CLASS program would collect for the first 5 years. All the while, the program wasn't required or allowed to pay out any benefits to individuals, so all the money would be coming in. Well, instead of holding on to that excess money being collected to pay out for future expenses, Washington Democrats here in the Senate used those funds to pay for President Obama's health care law. Fast forward, we now know for sure that the program is not financially viable and does not work. How do we know that? Well, many of us knew it while the debate was going on in the Senate floor a few years ago. But on October 14th of this year, Health and Human Service Secretary Kathleen Sebelius announced the administration will not implement the CLASS program. An op-ed that she has written appeared in the Huffington Post, and it said, as a report our department is releasing today shows, we have not identified a way to make class work at this time. The Obama administration had 19 months to figure out how to implement the program. They couldn't do it. Administration officials at the Department of Health and Human Services knew that the class program was unsustainable. And I believe that they knew it before President Obama signed the health care law. They knew it, the administration knew it, and the administration failed in their duty to be honest with the American people and tell them. Today, the White House still refuses to admit that the class program is a colossal failure. In the middle of last month, October 17th, 2011, White House spokesman said, repealing the Class Act isn't necessary or productive. What we should be doing is working together to address the long-term care challenges that we face as a country. How can the White House admit that this part of the health care spending law will burden taxpayers with yet another unsustainable entitlement program and at the same time demand that it stay on the books? I mean, how do they do that? So it just comes to me, Mr. President, when I received that AARP mailer, the AARP bulletin, the headline, "The Health Care Law is Already Working," by the Senate Majority Leader, I came to the conclusion that I needed to come to the floor with a second opinion. The health care law must be repealed. It must be replaced with reasonable, common sense, and financially sound alternatives. This health care law is not working. It's not good for patients. It's not good for providers, the doctors and the nurses who take care of those patients. And it is not good for the American taxpayers. So, Mr. President, I will continue to come to the floor of the Senate as we learn more and more about this health care law. It just does seem that just about every week or so, there is a new unintended consequence that comes forth, a new concern for patients, a new concern for providers, a new concern for the taxpayers. And I will continue to work with my patients and with my colleagues to find a health care law that gets patients the care that they need from a doctor that they want at a price they can afford. Thank you, Mr. President. I yield.